Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology. Today I am here to discuss the anti-asthmatic drugs part 2. In previous class we had discussed about anti-asthmatic drugs part 1. In previous class we had discussed about what is an asthma and what is the symptoms of asthma, what are the main symptoms that can cause the asthma, and we had discussed about the mediators, what are the such mediators involved in asthmatic condition to provoke the asthma condition. After of mediators we had discussed about the pathogenesis of an asthma, and after of that we had moved to the types of asthma, where there we having two types of asthma, one is extrinsic and second one is intrinsic asthma. And after of discussing these types of asthma we had studied about the classification of anti-asthmatic drugs. So there are 5 types of anti-asthmatic drugs. One is bronchodilators, okay, and next one is leukotrienes antagonists, mast cell stabilizers, corticosteroids, IgE antibodies. All these are the drugs which are used to treat the asthma. And after of that we had studied the mechanism of action of an individual drugs like beta-2 sympathomimetic drugs, where it will increases the cyclic AMP levels and finally it will causes the bronchial dilation. And second we had discussed about the methylxanthines. Methylxanthines are the drugs which will works on the enzyme, especially phosphodiesterase enzyme. It will inhibit this enzyme. By inhibiting this enzyme, which will causes the increase in cyclic AMP levels, and finally it will leads to bronchial dilation. And next one, leukotrienes antagonists. Leukotrienes antagonists will block the leukotriene receptor of leukotrienes, especially leukotrienes C4, D4, E4, which are responsible for the bronchial constriction. So these are the drugs which will reduces the bronchospasm. Mast cell stabilizers are the drugs which will stabilize the mast cell. It will inhibit the mediators. It will decreases the neuronal influxes. All these are the drugs we had discussed in the previous class. So without any further delay, we will just dive into the today class, which are the anti-asthmatic drugs part 2. So here we will discuss about the pharmacological actions. So pharmacological action, first we will discuss about central nervous system. So what is a central nervous system? Central nervous system. So central nervous system is a system by where the drugs, very few drugs, so lot of drugs will act on this system and it will causes the desired effects, side effects, right. So here the methylxanthines, especially caffeine and theophylline, right, methylxanthines. So what are the two drugs? The methylxanthines and caffeine. So sorry, here the caffeines and theophylline are comes under methylxanthines. This will stimulate the CNS. So if I am talking about methylxanthines, okay, methylxanthines. What are the three natural occurring methylxanthines? What are the three what are the three natural occurring methylxanthines? First one is theophylline. Second one is caffeine. Third one is theobromine. So these are the three natural alkaloids. These are the three natural methylated xanthine alkaloids. What are the three natural methylated xanthine alkaloids? Theophylline, caffeine and theobromine. These are the three alkaloids which will stimulate the CNS drugs. So these are the drugs which will stimulate the CNS system. Primarily effects on the higher center. It will be the where the effect will see, we will see the effects on the higher centers. Okay, next one is caffeine. If we discuss about the caffeine, caffeine is also a methylxanthine drug. It is also a methylxanthine drug. It will induces the CNS. It will stimulate the CNS. If you are taking in a therapeutic dose, here I am saying if you are taking the caffeine in a therapeutic dose, it will produces the sense of well-being and alertness. If the dose has been increased, if you had taken the dose of the caffeine in increased dose, or if you are taking any methylxanthines in increased dose, what is going to happen here? You can produce the nervousness, restlessness, panic, insomnia. Insomnia is termed as loss of sleep. Okay, all these are the side effects you observed when you had taken in a high dose. In a therapeutic dose, it will produces the sense of well-being and alertness. But when you are taking in a high dose, it can produces the nervousness, restlessness, panic and insomnia. So these are the action of methylxanthines on CNS. And now we will move into the CVS. So what is any CVS? CVS is a cardiovascular system. So methylxanthines directly stimulate the heart. How it will directly stimulate the heart? Have you remembered in the lecture 1 I had said that the methylxanthine having 3 cellular effects. One is inhibiting the phosphodiesterase enzyme, second one is inhibiting the adenosine receptor, it means adenosine receptor antagonist, and third one it will release the calcium from the sarcoplasmic reticulum, especially skeletal muscle and cardiac muscle. It can release the calcium from sarcoplasm, especially in the cardiac muscle. So, the methylxanthines directly stimulate the heart. By stimulation of this heart, what is going to happen? It will increases the force of contraction. The force of contraction also will get increased. Okay, if the force of contraction has been increased, then what is going to happen? The heart rate also will get increased. So, if you see here, the tachycardia is a terminology where you can say that increase in heart rate. Increase in heart rate is a major or main common effect you can see with the theophylline drug. So, theophylline is also a methylxanthine drug, caffeine is also a methylxanthine drug, but these two drugs having in a different action with the CVS. Okay? The theophylline is a drug which will causes the tachycardia. Caffeine is a drug which will decreases the heart rate. If it decreases the heart rate, what is going to show its action? Bradycardia. It means theophylline will shows the tachycardia, it will increases the heart rate. Caffeine, it will shows the bradycardia by decreasing the heart rate. Both are the methylxanthines, right? If you are given in an increased dose, so if you are giving the methylxanthines in an increased dose, what is going to say on the CVS? If you are given in increased dose, if you are given in a high dose, as the dose has been little slightly increased, then you can see the cardiac arrhythmiasis. So, cardiac arrhythmiasis is the common effect you can see with the methylxanthine drugs when you had increased the dose in a little bit more. What is an arrhythmia? What is an arrhythmia? Arrhythmia is an irregular heartbeat, where you can see here the irregular heartbeats is termed as an cardiac arrhythmia. So, at a high dose you can see the cardiac arrhythmia. And next one, smooth muscle. So, what is the action on smooth muscle? What are these asthmatic drugs will act on the smooth muscle? All the smooth muscles will be relaxed, especially bronchial muscle. So, every smooth muscle in the body will be get released after taking of these drugs, but especially bronchial muscle will get relaxed in the asthmatic patients. And if you see here, theophylline is more potent than caffeine. Theophylline is a drug which is more potent, right? It is more potent than caffeine, and slow and sustained dose related bronchodilator. Slow and dose related, it shows the theophylline will shows the dose related action. Why I am saying it shows the dose related action? Theophylline is a narrow therapeutic index drug. It having low therapeutic index drugs, as the dose increases, the action will get toxicity, the action will shows, the action will also will get according to the dose of any drug which you had given here. Okay. Here the slow and sustained dose related bronchodilation is produced, but the effect is less much compared to that of an inhaled beta 2 agonist. Here I had compared with the two drugs, one is methylxanthine drugs and second one is beta 2 agonist drugs. What are the two methylxanthine drugs I had discussed here? Theophylline and second one is caffeine. If I am talking about these two methylxanthine drugs, theophylline and caffeine, the theophylline is the more potent compared to that of caffeine, and this theophylline will shows the less marked effect compared to that of the inhaled beta 2 agonist. So, inhaled beta 2 agonists are the drugs which are the choice for the bronchodilators, which are the choice for the asthmatic conditions. And next one is kidney. What is the action of methylxanthines on kidney? So, methylxanthines having the mild diuretic action. So, what is a diuretic? What is a diuretic? Diuretics are the drugs which will increases the urine output, right? So, methylxanthines are the drugs which having the mild diuretic in action, it having the mild diuretic in action. So, which it having the mild diuretic action, this mild diuretic action, because of this diuretic action, it will inhibit the reabsorption of sodium and water. In addition, this methylxanthine having the vascular effects. What type of vascular effects? In addition, these vascular effects may result in increased renal function, increased renal blood flow and glomerular filtration rate. So, methylxanthines can increase the renal blood flow, right? Methylxanthines are the drugs which will increases the renal blood flow and it will increases the glomerular filtration rate. So, these are the two conditions which you can see with the methylxanthines. And methylxanthines like theophylline, it is a more potent, but its action was very much brief. Okay, what is the action of methylxanthines on kidney? It having the mild diuretic action, it will inhibit the reabsorption of sodium and water, okay, and in addition it having the vascular effect. What are the vascular effect you can see with the methylxanthines? It will increases the renal blood flow and it will increases the glomerular filtration rate. The action of theophylline is very much potent, but its action is very brief. And next one is skeletal muscle. When you had given the drug caffeine, it will enhances the contractile power of skeletal muscle. Caffeine is a drug, it is a drug which will enhances the contractile power of a skeletal muscle. If you had given the caffeine in a higher concentration or if you had given in a high dose, it will increases the release of calcium from the sarcoplasmic reticulum. So, from the sarcoplasmic reticulum, if the calcium has been released, when it has been released, when you had given in a high dose, by direct action it can release the calcium from the sarcoplasmic reticulum when you had given caffeine in a high dose. In a normal dose, it will enhances the contractile power of a skeletal muscle. And next one is CTZ. What is a CTZ? Chemoreceptor trigger zone. So, CTZ is termed as chemoreceptor trigger zone. Here the drugs, the methylxanthines will stimulate the vagal center, it will stimulate the respiratory center and it will stimulate the vasomotor center. So, these are the actions with methylxanthines. And next one, pharmacological actions of blood vessels. Here especially in blood vessels, if I am talking about blood pressure, the blood pressure action has been varied and unpredictable. Why it is unpredictable? Because here the vasomotor center and direct cardiac stimulation result in increase in blood pressure. Repeating the point, vasomotor center and direct cardiac stimulation will result in increase in blood pressure, and vagal stimulation and direct vasodilation action. Vagal stimulation and second one is direct vasodilation action result in decrease in blood pressure. So, because of vasomotor center, you can see the blood pressure in increase, and because of vagal stimulation you can see the blood pressure decreased. So, these are the varied of action when compared to that of the methylxanthines. So, methylxanthines having the varied action on the blood pressure. So, because of vasomotor center it will increases the blood pressure, because of vagal stimulation it will decreases the blood pressure. And next one is mast cell and inflammatory cell. So, what is the action of these drugs on the mast cell and inflammatory cell? So, if you see here, theophylline is a drug which will release the histamine and other mediators from the mast cell. So, it will decreases the release, it will not increases, it will decreases the release of histamine and other mediators. Theophylline is a drug which will decreases the release of histamine from the mast cell. And what are the adverse effects here? The next part was adverse drug reactions. So, what are the adverse drug reactions here? Adverse drug reactions, it means you can see the drug, what the side effects you are going to see with the particular drug. So, if I am talking about the theophylline, it is a methylxanthine drug, right? Theophylline having the narrow margin of safety. What is meant by narrow margin of safety? Which you can call as low therapeutic index. Narrow margin of safety, which you can call as low therapeutic index. So, which drugs having the low therapeutic index? Can you list some drugs which having the low therapeutic index? Theophylline, it is having the narrow therapeutic index, and second one is anticoagulant drug. Anticoagulant. Okay, anticoagulant is also a drug which having the narrow therapeutic index, especially warfarin. So, warfarin, especially warfarin also having the narrow therapeutic index, phenytoin, respiratory stimulants, all these are the drugs which having the narrow therapeutic margin. Okay, so, if I am discussing about the therapeutic index, the therapeutic index of also lot of the drugs has been fall into the two types of therapeutic index. One is low therapeutic index drugs and high therapeutic index drugs. So, what is the difference between the low therapeutic index and high therapeutic index? So, what is the main difference between the low therapeutic index and high therapeutic index? In the low therapeutic index, if you slightly increase in dose, it will cause us increase in toxicity. So, margin of safety is very low. And what is in a high therapeutic index? High therapeutic index drugs are the such a drugs, slightly increase in dose will not show any side effects or won't show any toxic effects to the particular drug. So, what are the drugs falls under high therapeutic index, penicillin. Even penicillin can causes the allergic reaction, but if the dose has been increased in a little more manner also, it won't shows any toxic effects in the body. So, these are the drugs which you can cause the low therapeutic index and high therapeutic index. So, here I had discussed about the therapeutic index. We are having two types of therapeutic index drugs. One is high therapeutic index and low therapeutic index. So, what is a therapeutic index? Therapeutic index which we can represent as LD50 by ED50, right? LD50 by, what is in therapeutic index? Therapeutic index we can represent as LD50 by ED50. Median lethal dose by median effective dose. So, let us forget it is not related to our topic here. So, there are lot of drugs which falls under high therapeutic index and low therapeutic index. Now, coming to the topic, theophylline is having the narrow margin of safety. What is a narrow margin of safety? It having the low therapeutic index. By the low therapeutic index, if the dose has been slightly increased, the toxicity also will get increased in the body. So, what the toxicity effects you can see with the theophylline, the toxicity effects, especially the therapeutic concentration range, you will see in the upper respiratory part, right. The adverse effects, the dose dependent toxicity starts from the upper part of a therapeutic concentration route. So, the dose dependent toxicity will start from the upper part of a therapeutic concentration range. And if you are saying if you are talking about the adverse effects, mainly adverse effects falls on GIT, CNS, CVS. Okay, all these are the side effects we can see with the anti-asthmatic drugs. In CNS you can see the insomnia, restlessness, nervousness, panic. On CVS you can see if you slightly increase in dose, it can causes the cardiac arrhythmia. Okay, GIT. Here I am talking about GIT. What are the GIT? What are the adverse effects of GIT? So, if I am talking about methylxanthines, when you had given to the particular patient, it will increases. What is the action of methylxanthines on GIT? It will increases the acid secretion and pepsin secretion from the stomach. By increasing of acid secretion, GIT, what is going to see here? Acid secretion and pepsin. Pepsin secretion will get increased. Here in GIT, methylxanthines will increases the acid secretion and pepsin secretion. And when you had given in a peritoneal route, when you had given this drug in a peritoneal route, it will causes the GIT irritation. And if you compare with caffeine, theophylline having the more gastric irritation. So, compared to that of caffeine, the theophylline having somewhat more gastric irritation, but the caffeine will shows irritation in such a way compared to that, which the caffeine will shows decrease in gastric irritation compared to that of theophylline. So, these are the adverse drug reactions on GIT. What is the adverse drug reaction on GIT? You can see here gastric irritation. Gastric irritation is due to because of acid secretion and pepsin secretion has been increased, or if you had given any drug, if you had given any methylxanthine on peritoneal route, it can causes the gastric irritation, and this gastric irritation will be seen more with the theophylline. And children are more liable to develop the CNS toxicity. So, if you had taken here especially children's pediatrics, so pediatrics will develop the more CNS toxicity. While giving these drugs, you have to take very much caution while giving or while prescribing to the children, because these are all the drugs comes under narrow therapeutic index. So, narrow therapeutic index are the drugs which having the low safety margin. And the next one is drug interaction. So, what is any drug interaction? Drug interaction is any drug interaction, what you can call as a drug interaction here. If one drug will modify the action of another drug, it is called drug interaction, right? What is a drug interaction? If one drug is going to modify the action or modifying the action of another drug, then you can call it as a drug interaction. Drug interaction is of mainly two types, pharmacokinetics and pharmacodynamics, okay, which is not related to our topic here. So, if you see here drug interaction, if you take the theophylline, right, theophylline will decreases the effect of phenytoin and lithium. So, if you are taking theophylline with two drugs, or either if you are taken with the anti-epileptic drug, phenytoin, which type of drug it is? It is an anti-epileptic drug. Lithium, which type of drug it is? It is a drug which is used to treat the mania, right. So, if you are taking these drugs with theophylline, the effect of phenytoin and the effect of lithium will get decreased. So, the anti-epileptic action and anti-manic action will be get decreased by taking of drug combined with the theophylline. This is the one of the drug interaction with theophylline. And if you are taking theophylline with some other drugs like furosemide, digitalis, oral anticoagulants, hypoglycemics. Okay, theophylline will increases the effects of furosemide, digitalis, anticoagulants and hypoglycemic agents. So, if you see here furosemide, what type of drug it is? Furosemide is a drug. It is a diuretic drug. It is a high ceiling diuretic drug, right? Furosemide is a high ceiling diuretic drug. If you are taking this drug, I have already said you methylxanthine is having the moderate diuretic action, it having slightly diuretic in action. So, theophylline having the diuretic in action, furosemide also having the diuretic action. If you are taking these both drugs in a combination, definitely it will increases the action of one drug by the another drug, right? Furosemide is a diuretic drug. Which type of diuretic it is? High ceiling diuretics. And next one is digitalis. What is the drug digitalis? It is a cardiotonic drug. And next one is oral anticoagulants. So, what are the oral anticoagulants? Oral anticoagulants are the drugs comes, what is the example here? Oral anticoagulants, what is the example here? Warfarin. Warfarin is an oral anticoagulant. So, if you had given warfarin along with theophylline, the action of warfarin has been increased when taken with the theophylline. And hypoglycemics. Hypoglycemics are the drugs which are taken to decreases the blood glucose levels in the body. So, hypoglycemics, what is the role of hypoglycemics? Well, hypoglycemics are the drugs which will decreases the blood glucose levels in the body. So, if you are taking the theophylline with such a drugs like furosemide, digitalis, oral anticoagulants or hypoglycemic drugs, the effect of all these drugs will get increased by taking with theophylline. But one point you have to remember here, theophylline having the narrow margin of safety, and anticoagulant, oral anticoagulant warfarin, right? Oral anticoagulant, what is the example of oral anticoagulant? Warfarin. Both drugs having the narrow margin of safety. So, if slightly increase in a dose can leads to the toxicity. So, theophylline, if you had increased the theophylline dose slightly, it will causes the toxicity because of its narrow therapeutic index. Oral anticoagulants also increases its toxicity if you slightly increase in dose because it having the low therapeutic index. If you are combining with these two drugs, you have to take little bit caution. All these are the drugs we can take here. Next one is, what are the drugs will causes the bronchial spasm. So, what is a bronchial spasm? In previous lecture I had discussed bronchial spasm is a sudden constriction of any muscle. Which type of muscle? Bronchial muscle. So, when you see the sudden constriction of a bronchial muscle, then you can term it as a bronchospasm. It will happen suddenly. Suddenly the muscle will get constricted. So, because of this muscle constricted, there you can see the constriction of bronchial muscle, right. So, there are some other drugs which will causes the asthma. So, what are the drugs which causes the asthma? So, there are some drugs which known to cause the asthma like aspirin and other NSAIDs. What is meant by NSAIDs? Non-steroidal anti-inflammatory drugs. So, even aspirin is also a non-steroidal anti-inflammatory drug, right. So, what is the full form? Stands for NSAIDs, non-steroidal anti-inflammatory drugs. Aspirin and other non-steroidal anti-inflammatory drugs will cause the bronchospasm, and there are some other drugs which can causes or which one causes the asthma like beta adrenergic blockers. Do not get confused here, beta adrenergic agonist drugs are used to treat the asthma, and the blockers are the drugs which causes the asthma which causes the asthma. And next one, cholinergic drugs. Cholinergic drugs are also drugs which can causes the bronchial asthma. Quinine. Quinine is also such a drug. After taking of this drug, it can induce the asthma, it can causes the bronchial asthma, it can causes the bronchial spasm. Morphine. So, which type of drug it is? Morphine. Morphine is an opioid drug, right. It is a narcotic drug. What is the action of morphine? Why it causing the bronchial spasm? It causing bronchial spasm by releasing of histamine from the cell. If you release the histamine from the cell, morphine is a drug. So, which type of, just now I had discussed the morphine is an opioid opioid drug. It is a narcotic drug. Morphine is a narcotic drug, right. Morphine is a narcotic drug. Morphine is a narcotic drug. By giving of this narcotic drug, what is going to happen? It will release the histamine from the master cell. By releasing of histamine from the master cell, it will causes the asthma. And next we will discuss about the uses. These are all the uses of the bronchial asthma. So these are the uses of an asthmatic drugs. You can use in a bronchial asthma, you can use it in COPD, you can use in apnea premature infant, or you can use the leukotrienes in prophylaxis therapy. And this montelukast is used more because of its once in a day. So why you are preferring the montelukast? Because you can take it once in a day. So these are all the uses. You can use in the bronchial asthma, you can use in COPD, you can use in a premature infant, which patient or which person having the apnea, and prophylaxis therapy, and you can use the montelukast due to because of once in a day therapy. Thank you.